Okay, good morning. Welcome to the presentation. I'm going to speak to you about how we use RGB-D cameras or 3D cameras for safety systems for a medical procedure called rotational angiography. My name is Rishi. I'm from the Eindhoven University of Technology, and this project was done in collaboration with Philips Healthcare, and the names of my collaborators are on screen. Right, so first, what's the application? To treat cardiac disease, a procedure called rotational angiography is used, in which we take 3D X-ray images of the heart. How we do this is using this X-ray machine, which is this big C-shaped system called the C-arm. When the patient is lying on the table, right, you have the heart in the isocenter. You send pulses of X-ray, and you get 2D images on the flat detector, which you can see on the screen. What you do is you can also rotate this machine in 3D. While rotating, you take multiple 2D images, you stitch them together, and you get a 3D image of your heart. Just to give you an example of what the motion looks like, I hope I can play this. This was playing in the morning.
Are you running on your PDF? Or
yeah, on PDF.
is it linked to another movie?
No, it's embedded inside. Wow, okay. I think we can just let that be then. What's the problem statement? Since we want the X-ray dose to be limited on the patient, because it's of course dangerous for the patient, these scans are high speed, right? While that is okay, the problem is that the detector which detects your imaging might hit the shoulder of the patient or the side of the patient, right? And this, of course, is a concern for both the patient and the medical community. The current practice, what they do is, before they start the high-speed scan, there is a low-speed test run. So they run the C-arm really slowly. They check whether the trajectory has some collisions. If there is a collision detected, they try and shift the patient a little bit so that you have a collision-free course for the system. This, of course, is done manually, and there are a few shortcomings. This procedure takes often many iterations, which means you lose out on time. This procedure right now is done manually, so you need manpower and you need a workforce from the hospital. And unfortunately, the biggest problem is sometimes due to the size of the patient, or let's say the way the patient is positioned, you cannot avoid a collision. And this only happens once multiple iterations are done, and then they find out, oh, we cannot do this procedure anymore. Well, the outcome is you have suboptimal workflow in a hospital, which is not good because you then have prolonged patient setup time, which leads to prolonged treatment time. Right, how do we solve this? Let's say when the doctor requests an RA scan, we say we do away with the current procedure of this trial and error slow run. We make a Kinect-based RGB-D system which detects the collision, which avoids the collision, and we can go to the full speed scan straight away. Right, so what does this look like? Like discussed before, there are many 3D cameras out there. What we use is the Kinect sensor. We place it on the throat of the C-arm because we want to see the patient table and the patient. That is what you get at the RGB image and the consequent point cloud from the system. Now, how do we detect the collision? We know the trajectory that our system is going to make, and it is always going to be a circular trajectory. We know the thickness and the depth of the detector, which is going to collide or which can potentially collide with the patient. We then create some zones in 3D space. And there are two main zones. One is the blue zone that you see, which is the collision zone. We basically create a hollow cylinder for this. And the hollow cylinder has a thickness, which is the depth of the detector, and a length, which is the height of the detector. Everything inside this hollow cylinder is the safe zone, which is the green zone. So if your patient is inside this green zone, you are safe. We are detecting collisions in a continuous space. which is obviously computationally a little bit burdensome. So what we do is we discretize our space, the blue space, into multiple occupancy grids, and that is what you see as the discretized volume in the third image. So what does collision detection look like? What we did is we placed a mannequin on the patient bed with a little bit exaggerated, in an exaggerated fashion such that the arm is out. We then see the intersection of the inner ring of our hollow cylinder, and we see there are multiple collision points which are marked in red. Right, so that's the detection part. How do we avoid collisions? Without going into a lot of details, we have a really simple solution. From the center of the hollow cylinder that we described, we take the collision point that is the furthest away from it. We then try and find the coordinates which will get the furthest point which is colliding into the safe zone, right? We have then the x and y coordinates that this point should move. We translate the complete patient point cloud based on these coordinates. And what we do is, instead of moving the machine or the patient manually, we can also move the table. So we feed these coordinates into the table, and the table is moved, right? We do this in multiple iterations to make sure that we check all kinds of collisions, and that's what you see here. With iteration 1 and 2, we detect a collision, we move the table, and then we have collision-free procedure. The point I discussed about getting to know that we cannot avoid a collision after multiple iterations, that's also what we treat. So once we segment out the patient point cloud, right, the patient size and the position they're lying in, we take the two extreme points on the left and the right, and we create a diameter for the patient. If this diameter is greater than the safe zone, you can never have a collision. You can never have a collision-free scan. Which is what we already then inform the surgeon about, and then they can decide whether they want to continue with the scan or maybe change the patient position. But we do this without any multiple iterations. Right, so it's good to say what we did, what the outcome is, but this is going to be a problem because now my video doesn't work, and I had a nice video to show you that we were able to avoid collisions. But this is how we did the experiments. So what they have now on the detector which collides with the patient is a capacitance-based sensor, which stops just before there is a collision with, let's say, the shoulder. So what we did is we start the system in the original position. We make it run at a really low speed. If it detects a collision, it stops. We then take the system back to the original position. We switch off the capacitance-based sensor. We turn on our collision prediction system, so with the camera and the motion planning. And we see if we can detect a collision. Once the collision is detected, we then feed the table coordinates which you're supposed to move with. I'm sorry that I cannot show you a video which would have kind of given this really clearly. But to conclude, with this system, what we can do is we can highlight potential dangerous collisions before the high-speed scan, and we can do these without any manual involvement and any iterations. More than that, we can also give a suggestion, or we can automatically plug in the movement that the table should have such that the patient is in the safe zone. And I think most importantly, and that's what also the people at the clinics are really happy about, is that we can tell them whether or not you can really perform a safe scan much before they would have then got. A few things to look into in future. Right now, everything we do is based on color segmentation, and that's not very robust because the moment you change colors in an environment, you're going to have problems. We want to use machine learning to classify the patient and localize the patient, and also the detector which the patient might collide with. We also, right now, we just checked the collisions with the patient and the detector, but we also have collisions with other things in the hospital room. That's something that we need to look at. And the last thing is I only showed you one scan, which was one axis. But this machine has a host of other scans, which are also potentially dangerous for patients because they collide. And we want to use the same technique for that. Yeah, with this, I end my presentation, and I would like some questions. Thank you.